I will be sharing some information on amyotrophic lateral sclerosis, also known as ALS. This is a disease named after Lou Gehrig. He was a baseball player who passed away from this disease. Okay, so what is ALS? ALS is a motor neuron disease where the motor neurons deteriorate over time and eventually die. We will talk later about what the motor neurons actually do. The symptoms of ALS are progressive, meaning that they don't get better, they actually worsen over time, and there's no way to stop them from happening, and there is actually no cure for ALS. Only 1 or 2 people are diagnosed per year, per 100,000 people, and it generally affects the older population. It doesn't affect a lot of children or young adults. So let's talk about motor neurons. They are a vital communication system within our body. They send signals from the nervous system, so from our brain and spinal cord, out to the body, specifically the muscles and muscle groups responsible for voluntary muscle movement. Voluntary muscle movement includes walking, talking, and mastication, which is chewing. There are 2 classifications of motor neurons. There's the upper motor neurons, which are located in the brain, and there are the lower motor neurons, which are located in the spinal cord. These motor neurons are vital to our daily being and living because voluntary muscle movement is very important. That's how we walk, that's how we talk and communicate and get by doing day-to-day tasks. What happens when someone is diagnosed with ALS is that these motor neurons are decaying. There's a disconnect. They're not as strong. They're not as, they don't last as long. They start to die. And that deterioration or decay of the motor neurons cuts off the signals to our muscles, which leads to us not being able to use them. As you can see here on the left, there's an image of a normal muscle, which has that nice shape that you would think of when you think of a bicep muscle. And then on the right of that image is an atrophied muscle. So muscular atrophy is the wasting away of muscle. So as you can see, it's a lot slimmer. It is clearly not been used because those signals have been cut off from the nervous system to the muscles. ALS presents itself in one of 2 ways. Bulbar onset starts with dysarthria, which is a slow or slurred speech, and limb onset starts with a loss of dexterity or agility in your hands. So people will notice that they may have a hard time holding their morning cup of coffee or using their keys to unlock the front door or even buttoning their clothes. Regardless of the type of onset symptoms, all symptoms end up the same, meaning that whether you have bulbar onset or limb onset, you're going to experience the same symptoms at some point in time during your battle with ALS. Other symptoms include spasticity, which is a stiffening of muscles, myasthenia, which is weakening of muscles, dysphagia, which is difficulty swallowing, and dyspnea, which is difficulty breathing. And as I stated earlier, symptoms of ALS are progressive, meaning that what may start out with just a little bit of, sore muscles or weak muscles will lead to that eventual muscular atrophy that I mentioned earlier, where you are no longer able to use your muscles. So things like opening and closing your hands are impossible. Many people lose the ability to walk at some point and are in a wheelchair. So all of these symptoms may not be too bad at the beginning, but for example, the difficulty swallowing, that could eventually lead to the need for a feeding tube because you can no longer swallow food and get nutrients that is necessary for your body. And the difficulty breathing, as I'll discuss later, will actually potentially lead to the need for a ventilator. So all of these symptoms are progressive, and as I said earlier, there is no cure for them, but there are ways that you can cope with these symptoms and kind of make your quality of life better, which I will discuss a little bit later. Some common complications associated with ALS include aspiration, which happens when some food or some liquid gets down into your lungs. This usually happens when the muscles responsible for mastication and that dysphagia start to kick in kind of in high gear. So once your symptoms have progressed to a certain point, the risk of aspiration is greater simply because your muscles just are not strong enough. They're not receiving the signals to be able to really chew or control your swallowing as much. Another issue associated with the same muscles would be malnutrition. So if you're not able to get an adequate amount of food, or a lot of times people with ALS will get exhausted really easily just because they're having to use a lot more energy to do a lot less work with their muscles. So a lot of times they will just not want to put in the energy or effort to eat enough food and get enough nutrition. So those are a couple of things that can be really dangerous and need to be closely monitored by a healthcare professional. Another complication is depression, actually. This can be a very difficult disease to deal with, especially because a lot of the brain function as far as mental acuity and agility and IQ remain in place. So people have a very clear awareness of what's happening to them, but they cannot use their body. They become paralyzed, and that's very depressing. It's very frustrating. So that is something that should also be closely monitored by healthcare professionals and even friends and family, noticing differences in their mental health. People with ALS still deserve the same access to mental health care as anybody else. Another really common complication is pneumonia. So the diaphragm actually is the large muscle that is responsible for breathing. And ALS, the motor neurons, as they shut down and decay and die, eventually affects the diaphragm, which affects your breathing. And it can lead to respiratory failure. That's actually how a lot of patients with ALS end up losing their battle with ALS, is from respiratory failure and oftentimes complications from pneumonia. Unfortunately, ALS is actually pretty difficult to diagnose. There's not a clear test or exam that can determine that it is ALS. A lot of it actually comes from ruling out other diseases that will allow you to pinpoint ALS as the disease that you're fighting. It starts with a routine physical and neurological exam where a physician will test for muscular and neurological function, as well as gathering a full medical history and family history from the patient. If the physician suspects that it may be ALS, they will generally recommend an electromyography test. And that test, called an EMG test, will test the communication between the nerves and the muscles. And then if those tests come back with, yeah, that may be what we're looking at is ALS, they will conduct a nerve conduction study, and that will measure the electrical activity between nerves and muscles and identify if a nerve is able to send signals to a muscle. So as I said earlier, ALS, when those motor neurons start to deteriorate, those signals are not being sent from the motor neurons to the muscles. So this nerve conduction study kind of really solidifies that as, yes, that is a major symptom of ALS. That is likely what we're dealing with. A couple of other tests that are commonly used would be a magnetic resonance imaging, or an MRI. And that just gives a physician a very clear image of the brain and spinal cord. And that is used more to rule out ALS, because it will show a physician if there is a tumor or a herniated disc pressing on the spinal cord, or some other physical abnormality that may be causing the symptoms that this patient is experiencing. Another test that's used to rule out ALS would be lab work. So blood and urine samples can show some abnormalities that may lead the physician to diagnose a different disease, not ALS, but it won't show a confirmation for ALS. So it is used also to rule out ALS. What causes ALS? There is not a super concrete answer. There's still a lot of research being done, but there is more of an answer now than there has been before. I'm going to start with describing two different types of ALS. Similar to those types of onsets, the two different types of ALS present the exact same way, but one is called familial ALS, which just means that the person diagnosed, there's a family history of ALS. So someone along the line in their family has had ALS before. The other kind is sporadic ALS, and that just means that A person who has ALS has no family history of it. It just kind of happened, and it may have been from the same genetic mutation as someone with familial ALS, but there was no previous history of ALS. The familial ALS actually only affects 5 to 10% of those diagnosed with ALS. So that means that the majority of people are diagnosed with sporadic ALS. Scientists believe that there is a large genetic component to ALS, that there is an autosomal dominant inheritance, which means that there is only needs to be a mutation in one chromosome to manifest into ALS. They believe that there was a mutation in a couple of genes here, the SOD1 and the C9ORF72 genes, and those, especially combined, those mutations will lead to ALS. There's another cause that scientists are pretty sure of, and that is an increase in glutamate. Glutamate is a neurotransmitter that helps with communication and signals between neurons, and scientists believe that when there is a buildup of glutamate around neurons, so when they don't kind of do their job and dissipate, that can cause ALS. There's a lot of research still being done, so there's not a whole lot of information about it, but they have created some medications that will actually help with the glutamate issue, and that I'll talk about that a little bit later. There are also a lot of environmental factors, so a lot of sporadic cases actually end up being determined to have happened because of environmental factors. And these can mean exposure to different toxins or viruses. This can be a result of a trauma actually has been known to cause ALS. And there's a little bit of research about people who have served in the military actually are at greater risk for ALS. There's just still a lot of unknowns about what actually causes it, and there are so many different things that have been determined to cause it. So there's still a lot of research being done to determine a more specific concrete cause of ALS. All right, coping with ALS. Unfortunately, there is not currently a cure for ALS, although there are several treatments and coping mechanisms that can be used to improve the quality of life and even extend the longevity and life expectancy after a diagnosis a little bit. There are currently 2 medications that are approved by the FDA to treat ALS. One of them is thought to reduce glutamate, which is that neurotransmitter I talked about earlier, and this medication will slow the decay and degeneration of the motor neurons. And this is the one that will add just a few months of life expectancy, which is not bad when most people with ALS are given 3 to 5 years to live after their initial diagnosis. Although some people have been known to live up to 10 years after their diagnosis, most are within that 3 to 5 year range. And we all know Stephen Hawking had ALS, and he actually lived for, I think, about 50 years with ALS. So that's a pretty mind-blowing compared to the average. So the second medication out there is thought to slow the degeneration of those daily functions. So kind of just helps improve quality of life, slows down some of the atrophy, slows down some of the, difficulty using your hands, things like that, to help maintain as much independence as possible. Respiratory assistance. Most people with ALS need respiratory assistance at some point along their battle with ALS. A lot of them start with like a breathing aid, like a CPAP machine while they're sleeping at night, which is also used to treat sleep apnea. And that just helps make sure that you are breathing throughout the night. It kind of takes some pressure off of your muscles and your lungs of having to work so hard. And it also improves your mental health because you're sleeping through the night without waking up. You're not as tired when you wake up because you haven't had to work so hard to breathe. So there's a lot of benefits of the CPAP machine. Another respiratory assistance would be a ventilator. This one usually comes in later on down the line once that dyspnea is really progressed and you're having a hard time breathing 24/7. So this is where there's a tube inserted down your throat and there's a machine that is actually breathing for you. So it's doing the expanding of the lungs and it's blowing everything out, so it is doing all the work for you. Some people would opt for a tracheotomy, which is where the tube is surgically inserted into your throat instead of down through your mouth, and that gives a little bit more independence. I believe you can be awake when you have a tracheotomy, so that's a plus. And then there are a lot of therapies that just help improve quality of life. There's physical therapy, which is really important for continuing to move the body and use the muscles as much as possible. It can delay the atrophy a little bit, or at least counteract it a little bit. And just keeping your body moving is going to lead to a lot of good things. Increased mental health. When you get up and you get moving as much as possible, you just feel better. But it really helps kind of delay that atrophy. There's speech therapy, which actually can be helpful for speech itself. So utilizing the muscles and learning new strategies to really articulate your speech when those muscles in your throat and your mouth and your tongue are atrophying. But then speech therapists can actually also help with swallowing and eating, because it's a lot of the same muscles responsible for speaking that are responsible for chewing and swallowing. And then the third kind of therapy is occupational therapy, and that is really helpful for maintaining as much independence as possible with patients with ALS. So helping come up with new strategies and maybe ways to hold your writing utensil or your eating utensil, or how to make your coffee in a way that is possible for your new body that you're navigating. So there are a lot of things that kind of come together and help improve the quality of life for patients with ALS as much as possible. Researching ALS. There are a lot of scientists around the world conducting a lot of research regarding ALS. They are looking at cellular defects. So why are the motor neurons decaying and dying? What is causing that? Where is that coming from? What's starting it? Can we stop it? They're also looking at new drug therapies. So adding on to those couple of medications I mentioned earlier, how can they maybe produce a more effective drug to stop or delay and treat this disease? And also cell-based therapies, so a lot of stem cell research, and how can we maybe implement that into healing and treating and fixing and hopefully getting rid of ALS. That would be the ideal situation. So there is definitely a lot of research being done, and hopefully we'll have some more answers in the near future.